What is diabetic retinopathy? A complication of diabetes that affects the eyes is known as diabetic retinopathy. It is caused by harm to the blood vessels of light-sensitive tissue in the back of the eye, retina. Initially, diabetic retinopathy can only cause mild symptoms or mild vision problems. Ultimately, this can cause blindness. The people who suffer from type 1 or type 2 diabetes can develop this disease. The longer you have diabetes, the less controlled your blood sugar and the more eye complications you will have. The symptoms associated with diabetic retinopathy may not be evident in the early stages. As the disease progresses, symptoms of diabetic retinopathy may include dark spots or chains floating in your vision, floaters, blurred vision, fluctuating vision, poor color vision, dark or empty areas in your vision, loss of vision. Diabetic retinopathy usually affects both eyes. When blood is saturated in sugar, it can clog up the tiny blood vessels that supply the retina and cut off the blood supply. The eyes try to develop new blood vessels as a result. But these new blood vessels do not develop completely and can easily leak. Anyone with diabetes can develop diabetic retinopathy. Serious vision problems result from these complications, like new blood vessels that can bleed into a translucent, gel-like substance that fills the center of the eye. If there is minimal bleeding, you may only see a few dark spots, floaters. In more severe cases, blood can fill the vitreous cavity and completely block your vision. The growth of abnormal scar tissue is stimulated because of abnormal blood vessels associated with this condition, which can move the retina away from the back of the eye. This can cause dots in your vision, light flashes, or a severe vision loss. New blood vessels can develop in the front of the eye and interfere with the normal flow of fluid from the eye, causing increased pressure in the eye, glaucoma. The nerve that transfers images from your eye to your brain can get damaged because of this pressure, optic nerve. Ultimately, diabetic retinopathy, glaucoma, or both can lead to complete vision loss. You can't always prevent diabetic retinopathy. However, regular eye tests, reasonable control of blood sugar and blood pressure, and to avoid serious vision loss, early intervention is recommended. You can reduce your risk of diabetic retinopathy if you have diabetes by doing the following. Make healthful eating and physical exercise a part of your daily routine to manage your diabetes. Try to get at least 150 minutes of easy activities, such as walking, every week. Take oral diabetes medication or insulin as directed. Monitor your blood sugar. You may need to check and record your blood sugar several times a day. More frequent measurements may be necessary if you are sick or stressed. A doctor may suggest how often you should test your blood sugar. Ask your physician to help you quit smoking if you smoke or use any tobacco. Smoking increases the risk of developing various complications of diabetes, including diabetic retinopathy. Pay attention to changes in vision. Call your physician right away if you experience sudden changes in vision or if your vision becomes blurred, irregular, or hazy. Remember that diabetes does not necessarily cause vision loss. Playing an active role in diabetes management can go a long way in preventing complications.